as we think about those things, as the work that you all are doing impacts how people might look at how their lives are going to happen, what would be one way in which participating in a study would make you feel like you're doing something, and in fact, you are doing something that for many people might make you feel valuable? Because I think one of the things many people look for is, I want this to, I mean, this is a hard condition to go through. I would like this to actually make a difference, that I live through this. I really would like there to be a difference moving forward. I want to contribute in some way. And
this is a fantastic question, because as we all know, one thing that most all clinical trials struggle with is enrollment, or the recruitment, I should say. And, I'm going to take this as an accountability on my part, on behalf of all of us researchers, because I think sometimes what ends up happening is, when science talks here, and if we cannot, as you had said earlier, if we cannot bring it to a level of people's understanding, and don't undermine, people really want to know the information in the delivery process. So if I cannot give you the knowledge I have, which I went to school for, and translate it into a fashion or a manner that somebody who doesn't have the same background can understand, that's a flaw in our system. I genuinely believe if we can bridge that gap of knowledge with empathy, we will start seeing more and more people to understand what an empowerment it is to be part of research, where you're absolutely directly or indirectly passing on these answers, these data, or answers through these data, I should say, to your next generations. And that power just cannot be underutilized. So I think, again, it is because if you keep up people like you and your work, that lets us understand what it is that our community needs to learn, or is interested in learning or hearing, so that we can create our educational materials around that. The research study and the recruitment part comes later. Once people understand the science and the data and the why behind our work, I think the recruitment will come automatically.
Yeah, because I think if I get why you're doing what you're doing, and that what I can contribute would matter, well, then it starts to come together. But if I can't figure out, so what? So what's this test going to tell me? And if my brain is just thinking, well, from what you're saying, then it doesn't matter what kind I have. It's like, ooh, well, ouch. That's a really hard thing. And I think where we have two stumbling blocks right now is we have a lot of clinicians who were trained and educated in an era, and it's still happening today, quite honestly, that what does it matter what kind of dementia it is? All we have are these symptom management meds, and they aren't that great, or something that, I'm not even sure it's really super expensive. I mean, I guess I can see maybe if you have Alzheimer's, maybe it's worth exploring, but, I don't know. I mean, you're this or you're that, and I'm just a clinician, and the numbers of people that we're talking about, I think we've got a lot of clinicians who are not curious about the various dementias. And I'm sorry to say, not particularly knowledgeable about how a person living with it, or a family member, or someone providing hands-on care might describe some of the changes that they're noticing in a way that would help clearly go, that, we want to rule some things out, but it's sort of like, well, we can rule it out, but given this, and this, I'm pretty sure it's this. And it's sort of still this cowboy style. And I don't use it derogatory, but like, let's get going. We're done. Here you go. Here's your options. And, this is not something we can do a lot about. And I would love to say that's a rare occurrence, but here's the reality. I'm on the other side of the street, and I'm going to tell you it isn't a rare occurrence yet.
My background is I'm a medical doctor. I'm certainly not practicing. I'm not seeing patients, but yes, I will absolutely agree that big part of day to day for a medical physician is to making sure that you're speaking a language that your patient understands. And before you can do that, there's actually a great book that my company recently recommended that I read through, and it's by Dr. Jason Karlowitz. It's called Problem of Alzheimer's. And he does a great job of explaining that if physicians don't understand the importance of using the right terminology when you're talking to your patients, then those patients are taking that same misinformation, added confusion, because for a lot of them, these are new terminologies, and they're passing on to the next person. Yes. That's how misinformation continues. And earlier in your conversation, you also just mentioned how there are 5 FDA-approved medications for Alzheimer's, and they're all curing symptoms. I just recently had a conversation with somebody who is in the world of nuclear medicine, has been for the past 30 years, and their mother was unfortunately recently diagnosed with Alzheimer's disease. And when we were having this conversation, she was telling me what medications her mother is on. And multiple times she used the word to cure the disease, I had to correct them and say, you realize that medication is not curing the disease, it's for the symptoms. And so we went over what it means to have the recent first ever monoclonal antibody that got the accelerated approval by FDA, what that means now, what that may mean moving forward as early as next year. But it's important to use those terminologies accurately. And even while I'm talking to you, I'm constantly worried and concerned about, did I use dementia and Alzheimer's and all these terms in the right places? I really hope I did.
I know. And and that's one of the tricky parts. But when we say things like, well, this will slow the disease down, you need to take this medicine because it'll slow it down. It's like, well, that's not accurate. So, it may help with some symptoms. And so we want to try it and see if it will help with these symptoms that your mom is experiencing or that you're experiencing. But we'll weigh whether or not the benefit and the cost of taking them, we need to do that like we would do with any medicine.
Absolutely.
And yet, because it's the only thing presented, it then becomes something that I'll keep trying using, even though there may be some significant side effects to it that, that aren't that. And it's like, ooh, I wish we were clear about what exactly it's doing, so that we were accurate. And again, it's the accuracy that people don't get. And it maybe they heard it wrong, but I also know situations where clearly it was missaid and it then just snowballs.
Absolutely. And again, very well said, because I think this is an opportunity for a clinician to sit down with their patient and really take that time and say, here's where you fall if you are diagnosed with Alzheimer's disease. Here's what you fall on that spectrum of Alzheimer's disease. Here's the medication we're giving you, how that medication works, why I think it may or may not help you. And here are the side effects of that medication, just to kind of give that why behind what we're doing.
Right. Yeah. And so then when we talk about imaging, that's that additional piece. So this is why we're, and again, it's that representing it accurately so people can then make as we talk many times about, informed decision.
Yes.
So I'm going to pause us here in this conversation because we have covered a lot of ground. I am really curious about those of you who are listening, what you are taking away from this conversation and what questions you have back for us about this whole topic of this whole range of things we've covered. And so rather than put an end to it, I want to open it up. What questions would you like to ask if we come together again? What would you like to hear about so that we could bring it up, lay it out, explore it? Because this level of expertise is very different than my level of expertise. But if we go from researchers to working with clinicians, to working with families, to living with dementia, all these people need to come together and have reasonable conversations where we can work to understand one another, or we're not going to get where we really like to be with this thing called dementia, which is in a better place to understand the various pieces and parts and what we can do to make a difference. Any final words or thoughts?
No, I loved closing comments. I mean, and I'm going to go back to where we started the conversation, was what our job here is when these questions come in. Again, we are going to try to translate that information to a language that most all of us can understand. We're also going to not be afraid of asking questions, no matter what level of questions we feel it is. And then our answers hopefully will empower each and every one of us to continue to ask those questions, whether they may be to your clinicians or to your family or to the person you're taking care of. So this is a great opportunity for every single one of us in this room. So thank you for this opportunity.
Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching. And if you liked, if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out. And you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.